In the microbiology lab, the focus shifts to the unseen world of pathogens.
So this is part of the laboratory, and this unit is the microbiology unit. Here we deal with microorganisms. We deal with microorganisms, we identify them, and manage them from this unit. Quite separate from the other unit, just because of for the purpose of infection control. We take all the safety precautions to make sure that it is safe for people, for the workers, and also for our patients.
Just like any other lab in the hospital, we practice quality management system, a system whereby we have protocols that we follow while working on our samples. The samples that are received here in microbiology lab are urine samples, swabs. Say we wanted to understand what is actually giving a problem to some of our patients in the area of infections.
We identify these organisms through a series of tests, including microscopy, culture and sensitivity, among others. And we do this through a competent, trained laboratory personnel. Our personnel are trained, and they also go competence on a yearly basis. We give them stringent competence measures to ensure that whatever they produce is accurate and reliable. We also subscribe to international standards. Therefore, we test using international protocols, and we are accredited by South African accreditation systems to ensure that we adhere to whatever international standards requires us, especially the ISO 15819 standards. And as a lab, in the future, we anticipate to also increase our scope through embracing molecular techniques to diagnose diseases, which is more precise and accurate. And also, we want to embark on setting up a biorepository which will help young scientists and young researchers to come up with other diagnostic tools to curb this issue of antimicrobial resistance, which is now a global threat to the population, and which also affects the population of Mulago, both the inpatient and outpatient patients in Mulago. And this data we collect as we do the testing, we analyze it on an annual basis, and we create an antibiogram. This antibiogram is given to clinicians, or the whole clinic staff, and also those people who are in IPC, that is infection prevention control, to make sure they select the antibiotics which are effective to the antibiotics which are effective to treat these diseases which are emerging. And this antibiogram shows the trends and the characteristics of all antibiotics which we have set on these organisms, or what we would say germs, which patients present with when they come to the lab. And the process we do here in the lab, we grow the organisms. We grow the organisms, we put the organisms on the food that is the nutrients, the food that has the nutrients that the organisms will grow on. After we grow these organisms, we then, which in science we call it propagating, we again remove these organisms, and then we set them on different drugs. We set them on different drugs. If you see the discs here, these are different drugs. Like this is ampicillin, this is meropenem, this is ciprofloxacin. These normal drugs which we use when we go to the pharmacies to buy, and which Ugandans are using to buy. Though the question is, I urge Ugandans not to go to pharmacies to just buy drugs before coming to test, because if you don't test and you just go and buy drugs, you cause what we call antimicrobial resistance. Now, if you look here, when we set the drugs, they should have a clearance on them. If the clearance is big, we measure them and we see the diameter, and we see that if the clearance, we compare it with international standards, the set standards, and we see if the clearance is okay. If the clearance is not okay, as you could see, like this one, ampicillin here, as it has now resisted to this organism, that means a patient will go and take the drug and it will not work for them. So I urge Ugandans, kindly, when you go to the doctor, first tell them, before, when they tell you, I have a bacterial infection, you ask them which infection is it, so that you come to the lab, we test these infections, we set the appropriate drugs, so that the clinician or the medical doctor will give you an appropriate treatment to this infection. Ugandans embrace testing, embrace to know what you're suffering from, than rushing to the pharmacy and just buy drugs without being tested. And this is what we offer in Mulago, and even other government hospitals. These services are available.
Understanding infections at a micro level is essential for effective treatment.
After we have run, as I've told, after we have done the testing, so we compile the data, the data we have done on these patients for a year. So we analyze the data, we characterize the data. We see now which drug is resisting to which organism or to which germ. And then after that, we know that ampicillin is mainly resisting to this kind of germ. Amoxicillin is resisting to this kind of germ. And when we have collected this data, we now go ahead and present this to the infection prevention control team together with the clinician to inform them that, hello, these medications you are now prescribing are no longer working. Let us maybe combine or use another kind of drugs. That's what an antibiogram is all about.
Back in the day, we used manual techniques where we used to subject these organisms manually on the plates that have been shown to us. But with the new technologies, they came up with this equipment. This equipment is called BD Phoenix M50. 50 stands for the number of organisms that you can set at a go. Being that this is a national referral hospital and we receive a number of clients, we can easily set in 50 clients at a go, and within 18 to 24 hours, they have their results. So this machine, after isolating the organism, as it has been explained, we are able to set these organisms on a certain panel. This is how the panel looks like. This panel is used to identify and also show us which kind of drugs that are susceptible to these organisms. And this is the basis to which we come up with the antibiogram that has been explained to us annually to show us the patterns of how these organisms are responding to these drugs. It doesn't make sense to just give out drugs like what our clinicians do there. Treating empirically is very deadly to our clients out there. So it's better we first of all subject this organism to a particular drug and understand which exact drug is susceptible to this organism, and also to get the trends of the resistance mechanism. World over, we are suffering from antimicrobial resistance. So we want to curb this gap by coming up with such technologies, and we also encourage out there people to embrace this technology. Apart from this equipment, we also have this one called Bactec FX40. This one is basically for blood cultures. In science, there is what we call septicemia. Septicemia is whereby someone is having actively multiplying bacteria within their bloodstream. And for us to be able to understand which exact organism is affecting this particular person, we are able to subject these organisms to such an equipment. It basically incubates these organisms, and it's able to detect growth. So after knowing the growth, we are able to identify that organism by using this machine. Besides me is an incubator. This incubator is used to grow these organisms. The moment we set, an example is this plate. This is called a culture media plate. We subject this organism to this plate. This is the food for microorganisms. So when we put this organism on this plate, we are able to incubate it. So when we put it on overnight, this organism is able to grow. So this incubator is set at a condition that favors growth of these organisms. As we know, our normal body temperature is 37 degrees Celsius. So this incubator also incubates these organisms at that range, 35 to 37, to favor its growth. So after an overnight, we remove that organism and put it here, identify it, and come up with susceptible drugs. Then this is how a blood culture bottle looks like. So when we put here somebody's blood who is expected to have a bacterial infection or fungal infection, we are able to put it in this equipment, and then we follow accordingly. So among other equipment that we have in this microbiology lab, there is this equipment is called an inflometer. This is an accessory of this equipment. It's able to standardize which particular organism is needed, the turbidity. It enables us to know the turbidity of which organism we are to set. Then among others, we have a vortex machine. This one enables us to come up with the right suspension that we need when we are making McFarland standard. Among other equipments, we have this one is anaerobic jar. There are certain organisms that cannot be able to grow in presence of oxygen in the atmosphere. So we subject them to these anaerobic conditions whereby we deprive them of oxygen. They are able to grow within here. So this is an anaerobic jar. Among other equipments that we use here in microbiology lab, we have this vital equipment called a microscope. Without a microscope, lab may not be able to exist, because a microscope enables us to magnify these minute organisms to be able to see them as they appear. Then we have this dryer. This one enables us to dry these slides. These are called glass slides in microbiology or in science. They enable us to come up with the right morphological appearances of these organisms. Then we also have this Clinitech status. This one is called Clinitech status machine. This machine enables us to come up with the chemistries or the chemical presentation of certain parameters of urine analysis when we are doing urine analysis. So these are some of the equipment that we have. Among others, we have a safety cabinet there. That safety cabinet also is for our own safety when we are operating or when we are manipulating these organisms, because we know that in lab or in science, safety first. So we have to safeguard ourselves from acquiring these organisms. Then they talked about a bio repository. So that freezer we are seeing there is -85. It helps us to preserve these organisms for years, that in case we want to retrieve them, we are able to just thaw them and then be able to culture them again. Then we also have a lab fridge there. That lab fridge also enables us to preserve some things that we need, like reagents, blood culture medias, and the rest. So that one is also a lab fridge that we use here. Then lastly, we have this gas. This gas enables us to fuel the lighting system that we need to be able to sterilize these wire loops when we are handling microorganisms. So this is the wire loop I'm talking about. When we are culturing these organisms, we require these wire loops. So when we are sterilizing them, we need to kill organisms here to avoid transferring them from one plate to another. So these are some of the things that we have in microbiology.
You have seen situations whereby somebody is given a set of antibiotics and after a long period of time they don't work, he doesn't get better. So here what we are doing is to see which drug, instead of giving somebody a cocktail of antibiotics, we want to be specific so that if it is gentamicin, you use gentamicin alone. Not that they give you gentamicin, when you don't get better, they give you another one, they give you another one. This is just wastage of resources and also affecting the health of the patient. So here we are trying to be precise. Before you are given an antibiotic, we know we are giving it to you and it is going to work on the infection that it has on you. People present with malaria, with like conditions that look like malaria. They check for malaria, they don't see it, when the infection is because of a bacteria. So when we put the blood in the bottle that you have seen, that bottle, the media that is there, is food for bacteria. Then we put it here. It simulates like a human body. So this bacteria will grow, and once it grows, we will see it becoming turbid, cloudy. Then we know that there is presence of bacteria. So we isolate that bacteria and then put it on another media where we subject it to the drugs, we identify it, and then we know which drug is going to work. Not malaria, but now a bacterial infection, and now we determine the drug that handles that. Urinary tract infections in children, in women, all groups of people, urinary tract infections, and also these upper respiratory tract infections. Because we abuse drugs. You take a drug, then it brings, when you use a lot of antibiotics, now you're encouraging the viruses to grow or the fungi to grow because you are killing the normal flora. So urinary tract infections and upper respiratory tract infections.
As we manipulate our different technologies, we need to be safe. We need to be safe up to the extent that we don't contract diseases, we also don't take these organisms to our homes, because that will be very disastrous. So what we do is that there are different safety measures that are in place in this lab, and that includes personal protective equipment, where we need to be fully in working gear, where we have a coat that should be covering 3/4 of your body. The coat, this coat, lab coat, ensures that in case of a spillage, something spills on you, it is not able to reach your innermost clothes, and you are able to remove the coat and you remain safe. Of course, gloves are very important. You put on gloves, and the equipment that you see over there is a biosafety cabinet where most of the manipulations are done from. We have the waste bins. These waste bins, we use them to actually make sure that we deposit there the rightful type of waste, because the waste has to be categorized. So highly infectious, the red one is there, then infectious, the yellow one is there. At the end of it, the waste handlers come and take it for safe disposal.
The ever-expanding scope of Mulago's laboratory services is certainly key in shaping the future of diagnostics in Uganda.
High-quality laboratory services are one of the pillars of a strong health system. And by that, I make reference to Mulago National Referral Hospital. As you are aware, it's the largest and a highly specialized hospital in Uganda. So our mandate, as you may have been told, falls under 3 categories: training, healthcare delivery, and operational research. Now, all the areas that I've mentioned, clinical laboratory services are central to those 3 core functions of the hospital, because there's a lot that is needed in terms of data that is generated through the day-to-day activities that we undertake. As we support care with the examination of specimens from patients, you know very well that over 80% of the decisions that are made in a clinical setting in management and treatment of patients are based on diagnostics. So it's imperative that everyone out there in the public, you seek to get access to a test before you're treated, because then it helps to optimize resources. You get to know specific targeted treatment that's given to patients, and even the hospitalization period for patients is reduced because you know exactly what you're treating. So as Mulago National Referral Hospital, we have a number of areas that we operate. I'm glad that during your stay around or your tour, you were able to interact with my staff in the microbiology department, where we provide opportunity for identification of organisms through exposure to an environment that simulates what the body environment is like. So we give nutrients to these organisms to grow, and then once they are available in those samples, then we are able to know that this is what is causing disease in that patient. But beyond that, we go ahead and do what we call antibiotic sensitivity testing, where we try to simulate an environment where treating an organism outside. So we give different drug sets that are again tailored to specific organism type, because there are drugs that used to work in the past and are failing to work in the current, and that's what is called drug resistance or antibiotic resistance. So what the microbiology lab does is to help identify a suitable medication or drug that will treat the organism that has been isolated. That way it helps to reduce the effect of giving a patient a whole range of antibiotics, because you're struggling to think maybe it will be this one that will treat, it will be this that will treat, but in this case we give you targeted medication. So we simulate that environment outside. Once there's clearance, now clearance is the language that we use to show that the organism has been killed. Then we recommend to our physicians that this is the drug of choice that should be prescribed for this patient. So in a nutshell, that's what happens in microbiology. Now we've had, I'm sure you've also toured the hematology area, where we look at different blood types. And in disease conditions, you know that blood is a fluid component in the body that circulates everywhere. So somewhat along the way, we need to establish the level of sterility, because it has to be sterile. So whenever there's a disease that has attacked your body, certain parameters keep changing. So they give us an indication that there's a problem here. That's why when you go to any clinician, they will tell you, let's do a CBC, a complete blood count. Or in some other places, they will call it, let's do a full blood count. That way, you're trying to look at the different cell components in their distribution. Has there been a change due to a disease condition? So it becomes an indicator. Even in cases where we talk about cancer markers. So we do a lot of that in our labs. I will also go to the clinical chemistry or biochemistry area, where you're looking at organ function. That as you're moving, many times we do tests to establish the functionality of your heart, the functionality of your kidneys, the functionality of your liver, And that way, there are certain, we call them biomarkers. They are components that enable us to survive or to move as normal human beings. But when there's a problem, those biomarkers, those components keep changing. They are molecular components. Yeah? They are biochemical components within the body that make or form what we are as human beings. So when there's a problem in any of them, some of them are released into the blood circulation in higher numbers or in higher concentration. So that way we get to know that, oh, there's a problem with the liver. There's a problem with the kidneys. As you know that the kidney performs a very vital function of clearing the toxic components out of the body.
In every test result lies a story, and in every story, a reason to keep fighting.
As a country and as a hospital, I think I can say we are progressing, but probably we're not yet there where we're supposed to be. There is no charge unless you've come through the private wing of the hospital because you want or you like to have preferential treatment. But if you come to the general OPD, that's outpatient, or acute care unit, or any of the wards, services within the diagnostic lab services are entirely for free. And it's one thing that we commend government for providing access to such services. People are accessing them for free.
Thank you very much.
And I'm sure as you're walking in through the labs, you are able to see patients accessing these services for free.
That's true.
Yeah, services were available.
This has been Inside Mulago, expressing Mulago's diagnostic prowess. This is Uganda Broadcasting Corporation, where every discovery brings us one step closer to a healthier tomorrow.
UBC, inspiring Uganda.
Every Wednesday, live in our